want to bring this up as the last topic because, you know, I feel like it's one of those things where, again, there is a lot of fear and we don't really get educated again about our bodies, and I like to talk about the immune system of the mouth and what the saliva does and you know, different things relating to that. So let's jump in there, and I'd like maybe Michelle, you want to start by talking to me about the immune system of the mouth and how it combats pathogens, pathological microbes, you know, STIs.
So we have a lot of recurring themes in the body, so some of these things are the same. Anywhere we have a mucous membrane, which, you know, is where we're secreting stuff, we have parts of our immune system that are just kind of hanging around, waiting to grab up something and report it to the rest of the immune system and say, is this okay, is this not okay, should we start dealing with it? Saliva is acidic. It has, as Jen mentioned earlier, that's one of the ways that we can keep things out. Our stomach is our most acidic area, and that's why a lot of diseases don't come through that way. Like the stomach, if it gets down that far, it just kind of, most things, it neutralizes them because it can't survive in something that acidic. But the saliva has some of that too. We have bacteria that are part of our microbiome in our mouth too, just like any other part of our, you know, we think of our gut, but certainly the vagina and the any place that something is. I was thinking about it, it's not entirely the inside world yet. Our mouth and even all the way down through to the anus is still kind of outside world in a sense because we have this great barrier that only lets certain things in. We secrete stuff. Jen mentioned earlier a particular protein that our immune system makes called IgA, which is an immune little antibody that goes around and like gloms onto bad things that aren't supposed to be there, so that the immune system can sort of, it's like raises up a little flare and the immune system sees it and like comes and attacks. So that's I don't think there's anything big I've left out there in the mouth.
What about the the saliva contains enzymes that
Right,
destroy
yes,
gonorrhea?
exactly.
So kissing and cunnilingus don't actually spread gonorrhea
Right,
because of
exactly.
these enzymes.
Right, we have enzymes that in our saliva that we secrete to digest things. That's where digestion starts. But some of them overlap, and some of them are just their own special guys. That enzymes basically kind of catalyze reactions. These are proteolytic type enzymes, which means they like to digest proteins and things like that. So yeah, absolutely, we make those all the time. Anytime there's saliva in our mouth, which is all the time, there's enzymes and immune cells and acidity and just fluid that's moving it down to the stomach or out of our mouth, both of which are places that a lot of things can't survive. So it's pretty smart, just like the rest of our body.
Very cool. So one of the things that, like for example, with gonorrhea, fellatio, which brings the tip of the urethra near the back of the throat, can be one of the things that can infect the other partner. So of course, if our immune system is healthy and strong, again, we're going to be more protected. But how do you recommend that people sort of guard themselves in regards to oral sex? Like when is the saliva not enough, and when, you know, maybe Laurie, you want to speak to this, or what do you recommend?
I'm not
what
a
do you
medical
teach?
professional.
Jennifer, do you want to speak to that?
I think with oral sex, if you don't know your partner's status, there hasn't been testing or whatever, it's probably prudent and wise to use a barrier method.
I will say, if you're not going to use a barrier method, swallow or spit, don't let it sit. So, just
Right, that's just that all get it down to the stomach or
some
get it
people
out.
will, they'll start to swallow, but I'm not really sure if I want to swallow this, and it's just kind of sitting there, and should I spit it out, but I don't want to. Just either swallow it quick or don't at all.
And don't brush your teeth or floss
Don't
right
brush your teeth or
before,
floss
because
right
then you
before.
can create the little micro trauma that could be
Don't use really strong mouthwash right
Well,
before.
Yeah, so the mouthwash, especially alcohol-containing mouthwash or alcoholic drinks, they're gonna do a couple of things, like do damage, like actual physical damage to the mucous membrane, and create a more easier entrance way. They're also bacteriostatic, so all the good healthy bacteria that are in there preventing, you know, these pathogens from getting in are not going to work as well.
Yeah, just keep Altoids with you. That's good enough. And your mouth's going to be busy doing other stuff.
So I want to talk about for example, the rate of transmission of HIV from oral sex is very low, and again, we know with gonorrhea the saliva is protecting us. I found it really interesting. This is also from the CDC site. It says receiving fellatio, giving or receiving cunnilingus and giving or receiving analingus carry little to no risk of HIV transmission. The highest oral sex risk is to individuals performing fellatio on an HIV-infected man with ejaculation in the mouth. And so that speaks to what you said, and what you said about not knowing the status of your partner. But again, I want to focus on the strength of the body and how interesting that is, that, you know, giving or receiving cunnilingus, giving or receiving analingus, and receiving fellatio have little to no risk of HIV transmission.
But that's primarily because HIV by itself is actually a very weak disease, and
Right.
it can't sustain outside the body. So if you're doing cunnilingus, analingus, or anything like, I mean, most of the activity that you're doing is outside, and using your tongue, the likelihood of there being any tears or injury or anything happening like that, everything's, again, your intact skin, so that really mitigates your chances of receiving something like that, but they could answer to that.
Yeah, do you want to speak more to that?
Totally agree with you, what you just said.
Yeah, I don't think I have anything else extra to add to that.
Yeah, I mean, I think it's
I think
really.
you should be a medical doctor.
I
Sex
find
is so much more fun though.
I think you're in the right field. So, again, going back to sexuality, and one of the things I sort of want to end on again is the idea of what are high risk activities, or what are groups that are at risk, and so that we don't just think like we're all victims of sexual, you know, diseases or infections. But one of the, go ahead.
I was just going to say, in answer to I have several children. They've all grown up very open, speaking very openly sexually. My youngest daughter, who's 17, once asked me about her older sister, who's 27, and she said, "Lindsay tells me that she's had 1,000 partners. What do you think about that?" And she goes, "Isn't it dangerous?" And I said, I think that if it was all consensual and she had safe sex practices, then she's probably fine if that's what made her happy. And she's like, "Oh my God, I can't understand that." So we got into this long conversation about how so many of the STIs on college campuses run really rampant. What the likelihood is of so much more you have, and I'm sure that they see with their patients too, the one-night stands and, going to frat parties and the drinking and yeah,
It's the drinking.
Yeah, so I
Just
think what we're hearing is, again, drinking is a big factor, smoking is a big factor, and also having that intact skin and mucosal membrane is also really important for your immune system to do its job. Is there anything else you want to say, again, about sort of the rate of transmission of STIs? Or like, how much are you seeing when people walk into your clinics that oral sex is really an issue? Like, do you consider it a really high risk sexual behavior, or do you consider it? Okay. Yeah. Okay. Well, this is good news. Yeah. We have a question. We have a lot of questions.
Well, not just a question, but in fact, that most STIs are regionally active. So, for instance, a sex act in a place where there are no STIs present is very, very safe, but it's regional. So you'll find little pockets in counties or cities that so your rate in those cities is much higher than somewhere else. And we don't talk about that. We act like each sex act has the same risk value.
And I also encourage people to engage in oral sex just for the mere fact that if you're going to have sexual activity with somebody and you go down there, you've got a good eye of what's going on. I mean, you can kind of use that as a time to assess as to, like, rather than just kind of like sneaking in their pants and, okay, now I'm jumping on board. I mean, you can see what's happening here. Is this something I really want to check out?
And
Yeah, sex with the lights on is sexier. You can see what's going on. Yeah, you can use that as a time to clean and get sexy, but you can get a visual as to what it is that you're actually going to be doing. And if it's not something that you would be putting in your mouth, then don't be putting it in any other orifice in your mouth. I mean, it's just a good rule. So many questions.
So questions.
Yeah, I'm going to ask for some specifics. What should a person look for if they're with a new partner and they're getting an eyeball view? I mean, this is an awkward time to be like, oh, on second thought,
Let's just mutually masturbate.
what should they be looking? But what should we be looking for?
Anything that doesn't. Go ahead.
can you answer?
Anything that doesn't look normal. to
Like
you.
it doesn't
I mean,
belong. So
if anything that
abrasion,
doesn't look like it belongs, if there's any kind of lesions, if there's a rash, if maybe something's oozing that doesn't look like it should be oozing right now, you know? It's swollen in certain parts that shouldn't be I mean, anything that just doesn't resonate to you, anything that stands out to you like, huh, I wonder what's going on there. Just, you know what, just there's so many other things that you can do that you don't have to do penetratively.
Talk to us about what those other things are.
Oh, mutual masturbation is fantastic. You can have so much fun with lube, you can shower together, you can, you know, go up in here, you can just all kinds of good things. Fry has a question, he's pretty.
A bit of a statement regarding how rare it is to transfer orally. So in 2014, it was newsworthy. It was the first documented case of female-to-female transition of HIV transmission. And that in the history of 30 years of having this epidemic, it was the first time. And the situation was that one partner, it was a serodiscordant couple, one partner HIV positive, the other one not. They were practicing fisting while on her period. So then it got into her cuticles, so you had a break in the skin to break in the skin. You've got direct blood transmission. It wasn't from merely oral sex, which is a soft tongue on a soft clit in that sense.
We want to talk about herpes now.
Yeah, that was sort of coming to mind as well. So let's just take a moment to talk about herpes and oral sex. Jennifer, did you want to speak to that?
Well, just because cold sores are so prominent, and estimates in the U.S. are like 80% or so of U.S. adults probably have HSV type 1, which is usually associated with the oral. So, having oral sex with someone who has a cold sore, but the person with a cold sore going down on you, that can be a way to transmit. So just like the basic precautions of like not going there when you have a cold sore.
Just like you wouldn't want to be kissing if
You're right,
you had a
or
cold sore.
just
So
cold,
again,
yeah.
anything you wouldn't put
Right.
on your mouth or near your mouth,
But also
don't
knowing
put
that
your genitals.
80 to 90% is the vast majority of us.
Right.
So, again, get rid of that stigma. It's ridiculous.
You're weird if you don't
Yeah.
have it.
If you have HSV1, but you're in the prodromal stage and you don't know you have a cold sore, then obviously
Right.
you don't know one is about to
Yeah.
appear or erupt, but you're nevertheless able
Same
to
with
transmit.
HSV2 and
And you've got
generally.
HSV1, so
So
I mean,
just, yeah, it just makes sense to be cautious, but if it happens, it's not, the end of the world. HSV, like we were talking about warts earlier, for the vast majority of people, it's annoying, and yes, we would like to try not to transmit it, but if it does, it's especially HSV1, it's extremely common, extremely common.
And can you talk about what happens when the skin and mucosal membranes come into contact with a virus? What antiviral capacities does the body have at the skin, mucosal, and then blood level even to protect us? Like, again, how can we take care of ourselves so that, you don't always know if someone's about to have an outbreak, but again, how can we be empowered to take care of our own immune systems?
Well, I mean, to
Or what
answer
should
the
we-
technical
what should
half
we
of your
know?
question, I'll do that real fast, and then we can talk about the second half, which is, we kind of already touched on. It's not a whole lot different about the oral avenue than somewhere else, but yeah, I mean, when something hits our mucous membrane, we have immune cells that's this innate immunity, which means anything that's in there that's not normal, they're just gonna kind of like bash at it for a while and like throw things at it and do things that are just, doesn't matter what it is, they're just gonna. And then if it gets past that, or if it becomes more of a lingering issue, then there's the immunity that's deeper, that's in our lymph nodes and our blood, and those are the very specific kind, like the B cells and the T cells. And just because I'm an immunology nerd, I'll take one quick second to say that. So the reason that if we come into contact with our cold strain or our HPV strain and we don't typically get that strain again, it's because we have these awesome cells inside our body, these B cells that are memory cells, and they hold on to that memory of that thing that you overcame. You were amazing and you kicked its butt, and now you will, in most cases, not get that one again, because you will have we all have this library inside us of these little cells. It's amazing, that just constantly make small levels of these little antibodies, so that if you ever see it again, that little antibody that's just floating around binds to it immediately, and you get rid of it. It's not that you never catch that thing again. It's not like somehow you're inside a force field. Those things come at us all the time, but your body recognizes it and gets rid of it before you even knew you had it. So we quite possibly have been exposed to many other things and we just didn't know that we were. Our immune system just took care of it either through that innate immunity, or we've seen it before and our acquired immunity, our B cells and their friends got rid of it before we even knew we had it. So yeah, immune
And I
system.
have a quick question about immunity. Somebody asked during the break. They said that the reference keeps going back to drinking and smoking. They want to know, does that just mean tobacco or smoking anything? Because smoking marijuana as well, does that suppress the immune system?
There's a lot of junk in commercial cigarettes that affect the immune system in ways that probably like cleaner, like weed, whatever, wouldn't. I think smoking in general is immune suppressant because of just its effect.
Oxidizing.
Well, but also
Sure.
just the effect on like paralyzing the cilia that sweep, the mucus and the bacteria and stuff up and out. So there's a direct, so like if you're gonna use weed, like I think like edibles or vaping or whatever is probably better than smoke. Yeah.
We have a question? Oh, sorry, you first, yeah.
Okay. So not too long ago, I was at the doctor and I got tested for stuff, and I learned that that time that I was on my ass for 2 weeks when I was 23 was actually me getting mono. And so therefore it's dormant. I've been kissing people for years, and the doctor basically said to me, I don't want to tell you to stop kissing people, but it's not 100% that you couldn't give it to someone. And I was hoping you could shed some light so that I don't have to stress about this forever.
Yeah.
Do not stress about
Don't
that.
stress. Thank you. My girlfriend is here and very happy.
I said it's like glitter, it just kind of like lingers.
Okay.
And much like some of these, I mean, Epstein-Barr virus, that virus again, I mean, is so common, and the chance of you, I mean, it's infinitesimal that either someone hadn't had it really, because most people do, or that you would transmit it this long after the fact of some random reactivation. That's extremely unlikely.
Extremely unlikely.
And these are all branches of the herpes virus that were
Well, it's
discussed,
relative,
mono
but-
and Epstein-Barr and
Right, right.
It was shared earlier that you mentioned this condom that washes the latex before packaging. I didn't realize this was an issue. I was bummed to hear, and I'm wondering, are there any other companies that are washing their latex before packaging? Is this something that everyone agrees is a thing?
I mean, I think, right, it depends how long you spend with condoms inside your body, right? How much exposure, like, there's lots of things we do in life that give us exposure to things that are harmful. I would not worry so much about the exposure risk of a condom.
Thank you.
If you're a sex
Yeah.
worker and you're seeing
Yeah.
several
Yeah.
clients a day,
That's
that's
right.
something that you would.
Or if you're having
consider.
recurrent,
Yeah.
bacterial vaginosis and you're trying to figure out why this might be happening, that might be something to investigate. But yeah, I wouldn't,
Yeah.
Thank
stress
you.
about
Look at your processed meats.
Right,
Look
there's a
at
lot.
look at your plastic water
Right,
bottle.
I was gonna say, this
before
is
you
like the
worry
same
about
thing,
your
like once in a while I'll
condom.
drink out of a plastic water bottle, but
Yeah.
not every day,
Yeah.
that
The
kind of
study
thing.
done in Germany was based on women using one condom a day, and they found that the nitrosamine or carcinogen levels were higher than in food, I believe is what the study stated. So there's more literature online, and
Thank you.
can read about it.
I'm curious about the effect of the irritation that you receive from using a condom. I know I get really irritated for several days. Sometimes it just starts things happening down there. It messes with my
You could
my
have some
immune
kind of
system.
latex
Uh-huh.
intolerance
Yes.
or early
And
latex
that's, I
allergy.
think probably a lot of people have that, so I'm wondering how that worsens the possibility of contracting something.
So let me just rephrase the question for the video. So how do condoms impact the health, the balance of the vagina
If
and
you have a
or,
reaction.
and or the penis if you're having a reaction? What do you recommend?
Well, the short answer is yes. I think almost meaning that if there's anything that's irritating your system, obviously your body is telling you in some way that something isn't right. It's, any symptom, I always say, there's a little red flag, your body's saying something isn't right here. And if there's irritation, that can mean, abrasions and things like that. That's possible. I think if you're experiencing that on a regular basis, you should look for an alternative, one that is washed, one that, something, another way of expressing your intimacy, if that's, whatever it is. Something, I think, yes, it's worth not ignoring that your body's telling you that.
And also to look at if it's a lubricated condom, it
Right.
could be the lubricant that's triggering
A
the
lot of, they
reaction,
might be
not
spermicide
not
in
the
them, some people
latex.
get really sensitive to that.
Yeah,
Um,
not
Do you
on
find that
latex.
it's irritation, like you get dried out, or is it?
Dried out.
Dried out? A
You
trick
know,
for that,
and also the abraded and.
Okay.
Yeah.
A sex worker trick for that is they'll take vitamin E capsules,
Yeah.
just natural vitamin E capsules, and just place that in after sex, and it just like soothes everything. And it, like triggers your natural lubrication too. And that's something good to happen like as women as we age, just kind of like get our natural lubrication going too.
Wow.
Okay, excellent. We've got another question over here.
To piggyback on her question, would female condoms?
Internal condoms?
Yeah, internal condoms be a possible solution
Mhm.
for, because then you're not having as much shaking on the woman's side, but instead it's the man.
Internal condoms are fantastic too because they can be used, I mean, you can place it in and it can stay in your body for like 8 hours. And you can just be like ready for sex whenever, and you don't have to worry about the whole mess with condoms or anything like that. Might be something to consider trying to.
So it's a little broader on the outside, so
On
you're
the
getting a
outside,
little
so-
bit more protection on the outside.
And they can be used not just vaginally, people think female condoms, but there are plenty of people that use them anally as well, so.
And then, my actual question was.
Okay, quick, because we just have a few more minutes.
Okay, you heard all three of you say oral sex is not high risk, and that's the first time I've heard that.
It's because people don't like having oral sex.
And so I just want to get clear.
People don't want you having pleasure.
Are you saying like protected or protected? Like, could you go more into specifics around like the risk factors of oral sex and like transmission rates?
I personally don't worry about it too much, oral sex. Again, you get a good visual, you make sure everybody's clean. It's not something that I even concern myself with, personally.
But unless you're doing like receptive
Mhm.
fellatio with, those kinds of things, and again, if you haven't been tested, you don't know the status, just like it's bypassing some of the mouse immune, barriers.
I'll repeat from
I was just
the
gonna say,
CDC
yeah.
website. This is for verbatim. Receiving fellatio, giving or receiving cunnilingus, and giving or receiving analingus carry little to no risk of HIV transmission. So we consider that, think about other STIs. The highest oral sex risk is to individuals performing fellatio on an HIV-infected man with ejaculation in the mouth. So essentially when the tip of the penis comes into contact with the throat, correct me if I'm wrong, this is sort of the most high risk.
It's still,
Because the saliva and these enzymes are protecting you with analingus and cunnilingus and all of that, so.
Well, and you're actually getting ejaculate in your
Pass.
system.
Yeah, and when ejaculate gets into the system, yeah, then there's more risk there. Okay, so I know we have so many questions, and we just have a few more minutes left, but, okay, I'll take a few more. What was your question?
I'd like to be more clear on the distinction that you might make between marijuana and tobacco, especially if you use a strain that's going to dry your mouth out.
Right, so we know that saliva is a big function, immunologically, so yeah, anything mouth drying is actually going to be a problem on a lot of levels, even for like dental health, so we need saliva to help maintain normal immune function.
But other than the saliva, what about the ingredients in tobacco versus what you might find in marijuana?
Oh, I was just saying, look, anything that you're inhaling in your body is suppressing your immune system, from what I understood what she was saying.
I think there's a
So
gradation, as
there's-
Jen was saying, is
yeah,
that,
there's a gradation,
commercially
but-
prepared tobacco, there aren't a lot of great comparative studies, but from the things that we know, then to smoking marijuana and then to edible marijuana, perhaps, at least in the categories we've been talking about today, that might be a decreasing curve of risk. We don't have a lot of great comparative, like I said,
Yeah.
but,
And I don't know if there's any studies on it.
right, that's what, yeah.
But we do know that in most, like cigarettes from major cigarette companies you would buy, there's a whole lot of chemical shit in there that is like carcinogenic in and of itself, so,
One more question, right there.
Yeah, I guess I came kind of for selfish reasons, and that is that I've had venereal warts, and frankly, I don't know what that means or other things, and so yeah, so I was hoping for some good practical advice, because particularly I don't want to be any harm to any one of you lovely people here. So I kind of like, wound up wearing boxers all the time, feel real uncomfortable if a woman reaches for me, things like that. And so what's the brass tacks?
Do you want to speak to that?
I think if, like, many people have had warts, and, as I said, it's a low-risk strain of the HPV virus, not a risk factor for cancer of any part of the body, and most people will then clear that. So if you actively have an outbreak of warts, there is a risk of transmitting that. Chances are your partner, if they've had other partners, has seen that strain at some point in their past and has an immune, response to that, so it will not be transmitted. That being said, like, if you transmit it, it's really not the worst thing in the world. We have so many treatments for warts. They're, as I said before, they're just like annoying and cosmetically might be an issue, but they're really not dangerous. And so I just think being like open and communicating and
So yeah, I guess in terms of the safe sex talk or whatever, so I say, I've had warts, they've been burnt off to the best of my knowledge, but what do I say to them about their risk, or what, how do I kind of explain it to, because I think a lot of people will then, okay, fine, sorry, see you later, and that's fine if they want to do that, but I prefer it be otherwise.
Right, so chances are, that you cleared that virus a long time ago, that's all gone and not a part of our reality now. And, if we were testing for, if we did swabs routinely on men for HPV, many men would have it at various points, then many men would clear that. So just giving reassurance to a potential partner that you probably do not have it now, statistically. If you had it before, you very most likely have cleared it. It's not an issue now. And or that they have had it themselves and they've cleared it and they are going to be protected. Actual risk is extremely low.
Do condoms lower the risk of transmission?
Somewhat, but not entirely, because HPV is carried in the entire genital region, not specifically in like.
And you're covering the skin to the
skin.
penis, and you're only covering what's covered by the condom itself. So.
But there is some benefit to using a condom for HPV. And there's some benefit, I know it's another controversial topic, but with male circumcision, there's about a 30% decreased risk of transmitting HPV and HSV and HIV. So there are benefits.
Okay, so the last thing that I wanted to speak to was just the group that's the most at risk, which I want to finish with this. So according to, again, the CDC, adolescents and young adults account for nearly half of all new cases of sexually transmitted diseases, even though the group represents just 25% of the sexually active population. So you can see that this is really where the work needs to happen, that, okay, we've all come here to get our questions answered and to help open up our paradigm about sexual health, but who do we really need to be speaking to? We need to be speaking to the children, to the college students, to, again, age, what did I say, 19 to 25. So I want to just end on sort of like maybe any talking points you have to that people, how to have that conversation or something that you feel passionate about sharing with that group that's the most at risk right in the beginning of their sexual journey.
I love Canada's idea that they're doing sex education from a really young age and just making it just part of your life. I mean, if we taught kids how to drive in this country the way we teach them sex education, we would not want anybody on the road whatsoever. But this is your body, you live in it, you breathe it, it's who you are, so we should teach them how to use it properly without the fear, because I think that instilling the fear isn't preventing kids from having sex, unless it's the extreme and then they become the clients I see. Instead, it's just preventing them from being safe about having sex. And instead, they're sneaking off and developing risky habits, not just having
It's a reverse psychology. You tell them not to, and you don't say why, and it makes them want to.
Right. And we're worried because these kids are having sex so young, but 100 years ago, they were having sex and raising families and running a farm.
Yeah, I'm 14.
Taking care of everything. So they're not doing anything any younger than they used to be. It's just that we treat them because the way that we evolved, you know.
Infantilize.
Yes.
Okay, so
Thank
but
you.
I totally agree. I think by depathologizing sex, by making it a healthy, open conversation that you start having with your kids from the, the earliest times when they're touching themselves and not making that a shame-based, thing. And also taking, stigma away from, the withholding thing for girls, and so then they need to use alcohol in order to express themselves, and then when you're drunk, you're much less likely to, make sure a condom's used, and so it can happen on so many different levels, and it needs to happen. It's so great.
Yeah. Totally agree, and would just add that, we can continue this discussion in ways that are empowering and not fear-based, and that are about, the whole subject, and why Lauren, in a way sort of got this all together is about, knowing how, when we break things down into these little pieces, like, oh, sex is going to cause this and these things, we don't look at the bigger picture of how, how it interacts, how important it is for our lives in so many other ways, and as Gabrielle was bringing up earlier, because it kind of got lost in all the shuffle, that sex itself lowers our stress, which then lowers our risk of having sexually transmitted infections, and all these things that are so important to our just lives as people. Oh, they affect all these other things too. It's amazing. And so if we talk about how strong they are and how empowered they can be to make healthy choices, to make their immune system strong, to make their sex fun, but also safe, and all these things, I think we're going to go a long way to making this less of an issue.
Cool. Well, thank you again. Your penis is intelligent. Your vagina is intelligent. I hope you enjoy them. Thank you so much for being here.